And now, Dental Bites with the dental hygienists of Dental Post.
Hey friends. Okay, so sometimes we've been talking about like off camera before we start recording about like our days with our patients and giving them their home care aids that we prescribe for them or those types of things. And it was one of those things. It's like, what do you do with your home care aids, and like, do you give them to them or do you not give them to them? How does that process go? What is your guys' process with all of that?
You know, it's funny. I worked in an office once where we had no goodie bags at all.
Me too.
There was nothing. We didn't give anything. The dentist his philosophy was, well, everybody uses an electric toothbrush, and so like they don't need the manual toothbrush and whatever. And where I see where he was coming from, I missed having a manual toothbrush to do home care instruction with my patient. Like when I'm trying to be like, okay, the spot you're really missing, let's really get in there with our toothbrush. And they had no interproximal aids. And I remember I would run around shows and try to get as many interdental brushes as I could so that I could like start showing patients like how to do it. Because it's one thing to like, just, I don't know, like I would show them Amazon links and I'd be like, I want you to buy this, but I couldn't show it to them. So in that regard, I missed that stuff. But just having the basic goodie bag that just has the little the toothbrush that has their name on it, and the little toothpaste sample and the crummy floss, like that you give to everybody without thinking. I don't think that's hitting the mark. What do you guys think?
100% agree. 100%.
I agree as well.
Yeah,
I agree. It's even when my husband goes to the dentist, he leaves his goodie bag in the car for months and months and months and months and months. So,
or at the checkout counter all the time.
Yes.
Bags left at the checkout counter. I'm like,
yeah,
I just went over all this instruction.
Yeah.
I do like being able though to customize a bag, like with interdental brushes or a certain kind of toothpaste or something like that. You're really giving them what you talked about, what you think they can benefit from, and that makes more sense because you really don't go to any other appointments and they hand you a goodie bag of stuff on the way out. I mean, I don't know how that, right?
My GP with a goodie bag,
deodorant or something.
That would be nice,
right?
Well, I mean, yeah. Or if you are going somewhere, it is. I mean, because I've had some medical appointments where they'll have like a sample of some sort of ointment or something along those lines where you can like, here's one, give it a try. Let's see if it works for you. But it's one of those things only if you need it. It's not just your generic thing. And one of the things I always ask my patients is, all right, after you do the interview, like what's your current routine? What are the current tools that you're using to keep your mouth clean? All of those types of things. And then it's like, well, what do I have? I was like, well, I have this brand of toothpaste. Is that of interest to you, or will it just clutter your drawers? Because I don't want to be the reason that your drawers are cluttered. And they're like, oh yeah, no, I don't know. Or yes, actually that would be great. I totally would love to have that. So I think that's one of the things that we can have a conversation with our patient about is like, or I'm not giving this to you just to give it to you. It is for a purpose to not add another thing in your drawer that you have to throw away unused, unopened in 12 years.
And Tina, I think something too that a lot of people don't realize. So you said, if you go to the doctor, sometimes they'll have a sample of something you can take. Chances are they got those for free. A lot of people I don't think realize that it's a big expense on the practice to order the toothbrushes and the floss and the toothpaste. It's not free. And then to have your name printed on it. So there should be, I feel like, a little bit of thought put into them.
Yeah. So now speaking of not free though, Kim, what if there are some offices out there that do sell product that they recommend?
I totally agree with that.
Yeah. Like, you might have like the great, like your favorite dry mouth products or things like that and be like, hey, I really like this product. You could get that here, or I often will be like, or you can, here's a link to get it. But if you want to pick it up here, it's kind of like going to the vet and picking up your dog's heartworm medicine right there. You're like, oh, convenient. And I'm there.
Absolutely.
Like, I'm on it. Thank you.
So my office, we it's like a slippery slope with selling products. So we go back and forth. We flip flop every couple years. We flip flop because if we are selling the product and personally giving it to them, and let's say it breaks in a few months,
Okay.
they're calling us and they're complaining to us. And then we say, oh, get on the phone with, customer service of the
Oh.
product. But if it's a bad experience, they're mad at us.
Okay.
So we struggle with that sometimes. It's not,
Interesting.
most of the time the product, will work, but
Right.
every now and then. So I've noticed, because we just had a few lunch and learns, that I feel like the company is, I don't want to name exactly which ones, but they were giving us like QR code cards where instead of us having the product in our office, they give us a QR code. The patient scans a QR code, and right then and there, they're given whatever the list of different products, and we tell them which one to get, and they purchase it, and it goes to their house.
Oh.
So this is kind of something new. Like there were two
Yeah.
companies that just came in, went over it with us, and I'm like, you know what? That solves that problem. At least.
Well, you don't have to store it and stock it and go,
Correct.
oh,
Yeah.
and like, do we? How are we on supplies? We have one left. Do we reorder now? Is it?
Right.
How long is it going to sit on the shelf?
Right.
Yeah.
Mhm.
Yeah.
Yeah. What if practices had, how like some influencers, I don't know how it works. Maybe one of you guys do. Like they can have their own Amazon store.
Mm-hmm.
Yeah.
I think you have to have like so many followers to do it though. But anyway, like you could have like your own, like, and you could set up the products that you liked
Mm-hmm.
on your Amazon store. And
Oh,
what is
that's
that?
neat.
I mean, it has to be available on Amazon then, like, so it probably wouldn't work for all the products.
Yes, it definitely works though. Anything that's on Amazon, you put it in your store, then you can have the patient scan a QR code, takes it right to all your recommended products, and they can just purchase right there.
That's kind of cool.
Oh, that's a
That's-
really
yeah.
good
You
idea.
know what? That just made me think of like, how cool would that be for like dental hygiene programs? When the students are recommending items, that if that school had their own Amazon store,
Yeah.
you guys are thinkers. I like that.
See, it's
So-
clicking.
Cool. Create your Amazon store, and what a great little opportunity to have fundraising for the students too.
Yeah.
They can
Yeah, because I
sell
think they
right
get some
there.
kind of kickback. Yeah.
Yeah,
I'm sure. Yeah.
Cool.
that's cool.
All
You
right.
guys
So
are
I
thinkers.
think the point
That's
is customize your goodie bag or send patients off to buy it.
Yeah,
Yeah.
or as a patient, you can say no, thank you.
Right.
Yeah.
Options. Give them options.